What's up everyone? Welcome back to a brand new video here at Cuspide Insurance. My name is Carlos. I'm a licensed advisor and today we are going to talk about everything Molina healthcare. Last week we did a video on Oscar Health Insurance, like a buyer's guide, like a complete review of the insurance. And today we're moving on to another company and this one is Molina. There's a lot to learn here. Should you get it? Is it any good? Let's get into it. So we are going to be focusing all of this video on our article we did that's called Is Molina Health Insurance Good? The Ultimate Guide. It was released today, so April 1st. So let's take a look at it. Let's break it down. Is it for you? Is it any good? Let's go. Starting off with our key takeaways. They are ranked number 1 in customer satisfaction. They are known for their affordable prices. So usually, if you are in any of the states that they operate in, I'm going to get to that soon as well. They're usually the first ones or the couple first ones to appear as like the most affordable plan, depending if you get a subsidy or not. But they are always usually on the top 3 first to appear for the cheapest plan. So that's good if you're trying to save money and you only really care about trying to save money and getting the cheapest plan possible, then Molina is probably a good choice. They are also voted as the best for its provider network, and they are in Forbes' list for the top health insurance companies in America, ranking in at number 14. So let's continue. Is Molina Healthcare part of the Obamacare? Yes, Molina Healthcare is part of the Obamacare, as well as, I'm going to scroll down here, they also do Medicaid, Medicare, but they are a part of the Obamacare. Usually everybody leans towards their marketplace plans, but another popular thing with them is if you do qualify for your state, then you can get Medicaid through them as well. Kind of different requirements as the ACA, but pretty much sort of the same benefits that you may see. So moving on to the pros and the cons, this is kind of going to help you get a little more on track to whether this may be for you or not. So number 1 is they offer one of the lowest premiums in the marketplace compared to others. Like I said, depending on your area, on your state, which let's talk about the state for now. Coverage is only available in under 18 states. That's one of the downsides. So depending on your area, if your state happens to be one that Molina operates in, then it is going to be offering one of the lowest premiums without a doubt. It's always going to be at one of the top ones. So that's really good. Another pro is they're good for low-income individuals and families with their Medicaid coverage and CHIP coverage, the Children's Health Insurance Program. It's coverage for your children if you make too much to qualify for Medicaid and too little to get subsidized through the marketplace. You can get CHIP for your children. And you could also get Medicaid for them. So they're good plans for low-income individuals and families. And they are ranked number 1 for their provider network, as well as one of the leading companies, number 1. I quoted it and I linked to the article where they did the study. So they are number 1 in terms of customer satisfaction. So that's something to look out for. That's always a positive. Another con is that they are limited due to their network of only serving HMO plans. So if some of you don't know, there are 4 types of health insurance plans available in the marketplace. They're HMO plans, EPO plans, PPO plans, and POS plans. On the screen here is all of them. You can pause to read a little bit more about what each of them do. But yes, Molina only does HMO plans, so you will not find any of the other 3 plans with them. So that's kind of a little downside. So you will need, for example, with an HMO plan, you are going to need a referral to see your specialist doctor. So if you kind of don't like that, then they might not be for you. But if you don't mind, they are perfect. And lastly, they're limited to government-sponsored programs, so they're very tied pretty much the government, ACA, and Medicaid. And just talking about HMO plans, here is the list of all the HMOs, the names of the plans that they offer. Now, depending on your area, you're going to see some of these or you're not going to see any of these. They all differ, so it all depends on the subsidy that you get. So while it has the same names, you and your friend could apply and they're going to have the same names, but they're going to have different deductibles, different out-of-pockets, different co-pays, different premiums, because the subsidy you get is going to be different. But these are the plans that are going to appear. As far as which one's the best, it all depends. There's so many factors that go into it. So if your goal is to save money, then the best one for you is the cheapest one, etc., etc. How much do they cost? Again, it depends, but you can look at around $20 to $80 for the average Molina marketplace plan, which falls kind of under the usual average for health insurance. So that's good. And lastly, on the screen here is the coverage map. So you can see which state Molina is in. If they are in your state, then perfect. You now know an extra option with your newfound knowledge that you can check out. If they're not in your state, then the good news is that there are other carriers that do the same thing as Molina, which is provide affordable health coverage. So hopefully that kind of helps you out a little bit and to decide overall if you kind of want to lean towards Molina or not. Overall, here at Cuspide, we give it, like we said in the article, we give it a 3.5 out of 5 stars, just because some of the pros and the cons that we mentioned earlier, we think is very important for coverage. So if you want to get Molina or trying to see a quote for any other carrier in the marketplace, if you live in any of the states, just call the number on the screen here, 305-970-8583. You'll be speaking directly with me, and I will help you and your family get the coverage that you need, because it's very important. Thank you all so much for watching. Tune in next week. I'll probably do another company. Don't know what it is yet, so stay tuned. It's going to be important. It's going to be great. Thank you all so much for watching. Take care, everybody. Bye-bye.